We're going to talk about some muffin tops.
Define it, if you don't mind, for the
well,
people
I
at
think
home.
it's like what I got.
You don't have to show us, you just had to tell us. So let's say someone comes in and they're pretty flat here and they're just full here.
My move would probably be right to suction, unless they got very little, or their skin's real loose, in which case you got to do something different. Like, what would you do?
I think if I pinch it, I tell them whatever's in my fingers that I'm pinching here is some skin and some fat. And if it's mostly fat, and there's a lot, we should suction it. If it's just a little, do non-invasive like SCULPSURE. And if I'm pinching it and it's really not that much fat, it's mostly skin, we need to put an incision.
Who do you see as a really good candidate for SCULPSURE?
I think SCULPSURE patients don't have a ton of fat. They are unwilling to undergo a surgical procedure, so they don't want to go to sleep for it. And they are willing to accept a little bit less result to get that. You will have to repeat it several times.
We'll have
probably,
to repeat it.
At least 2, if not 3 or 4.
And at the end of the day, you're getting 20% of what you would get with liposuction. And for some people, that's perfect, because there really isn't downtime. If you have a small amount of fat, you don't want surgery, you don't have really the amount of time to recover from a surgical procedure, like none, then I think you're looking at SCULPSURE. But if you have an expectation that you want to do this one time, you want to get it all out as best you possibly can, you're willing to take a few days off depending on the amount of liposuction we're talking about. I think liposuction is probably your answer. If your skin's mostly...
When do you see that, like, okay, here's your result, like, here, this is as good as it's going to get, you're ready for the beach?
Well, it's funny because, like, as soon as you take the wrapping off the next day after surgery, that's about as good as it's going to get, and then you're going to swell. You know, and then that swelling's going to come down. You reach your max swelling, what, maybe 2-3 days after surgery, something like that, and then it starts to come out. I usually look around, 3 months is when we take our photos. By then, things are soft. Things are kind of tissues. You can work with them again if you needed to, but there's still some swelling in those tissues. You can probably see a continued result in softening of the tissues for a year. If somebody shows up with what they're calling a muffin top and the skin's kind of loose and they're not really candidates in your mind for liposuction or SCULPSURE, what's your fallback? What do you tell these people?
If they already have some loose skin, and so I know it's going to be loose after lipo, or if I think it's going to be loose because they have so much fat that I think it's going to deflate them with lipo, I will tell them either live with that extra skin, because you're going to have it, or we need to remove skin in some way. And on the abdomen, that's almost always a tummy tuck.
Why wouldn't you do a tummy tuck, though? I mean, it's a great surgery. It really tightens everything up. But there's a downside, right, to a tummy tuck?
A little more pain, a little more recovery. If you tell patients to take a week off with lipo, I tell them at least a week with a tummy tuck, and you might consider working from home the second week. Pain, you're going to need pain medication for probably another week. We'll be managing that incision and that scar, and so there's a little bit more risk by having a surgical scar. But we don't generally choose the surgery based on what surgery you want, because everyone wants the easiest, cheapest, less recovery. Sure. We choose it based on the results.
That's why it's very important for people to come in and talk to us, and because everybody is different, and 20% to you is reasonable, but 20% to somebody else is not. And so that's why we need to get a sense. And once you've talked with patients for years, I mean, you kind of get a sense what's going to work for people and what isn't, and that's why it's very important to come and talk to us.
You go to the website, you can read more detail about the procedures. You can see before and after pictures, and when you're ready, you can request a consult online and come in and see us in person.
Love to meet you.